Good afternoon. We are going to start the meeting. Members of the board, as your corporate officer, I'm calling this September 25th Sea to Sky Regional Hospitals District Board meeting to order at 3:09 p.m. We would like to recognize that this meeting is being held on the traditional territory of the Lillooet Nation. In the absence of the chair and vice chair, I'm requesting from the board a motion to appoint Sea to Sky Regional Hospital District Board presiding chair for this meeting.
I record Director Crompton's name.
Second.
All the way.
Okay, I accept the privilege. Thank you.
Thank you. I'll turn the meeting over to presiding chair, Director Crompton.
Thank you very much. We do not, call this meeting to order. We'd like to recognize that this meeting is being held on the traditional and ceded territory of the Lillooet Nation. Motion please to approve the agenda. Moved, seconded. Any opposed? Motion carries.
Chair?
Yeah.
I just wanted to say that I've got myself and the other Squamish representatives have a time constraint today, and we'll be leaving the meeting at 3:30 the latest, so we'll try to attend. But when we get up and walk out, it has nothing to do with what's being discussed or the chair's abilities. Just wanted to be clear on it.
But maybe don't speak so soon. Thank you for that. There is no closed portion to this meeting, correct? So moving on to the delegation. Our first delegation is from Sean Parr, Associate Vice President, Business Initiatives. Heidi Butler, Director of Coastal Sea to Sky. I should have read this before if I was Belinda Graham, Acting Executive Director of Capital Projects for Coastal and Vancouver Coastal Health. A large team of people here to speak to us today. We're grateful for your time. We have set aside 15 minutes for the presentation and then 5 minutes for question and answer afterward. If you can stick to that timeline, we would be grateful. With that, I will turn it over to you for the presentation. Welcome.
Well, thank you very much for having us. My name is Sean Parr. I'm Associate Vice President, and I will start the presentation, but I'm grateful to be joined by Belinda and Heidi, who you've introduced. If we can go to the next slide, I'm sure you've already done a territorial acknowledgement, but I just wanted to say in Vancouver Coastal, we are very proud of the work we do with our First Nation partners. And typically, we acknowledge the Coast Salish peoples in Vancouver-centric fashion with the Musqueam, Squamish, and Tsleil-Waututh. But given that we are in the Sea to Sky region, I would like to recognize the Skateen, Samokwam, Naquatka, Hatsa, and Lillooet nations as well. So thank you. If we can move on to the next slide, I'm going to be brief because I think the meat of the presentation will be covered by Heidi and Belinda. But just to give you a sense of an overview of what we're going to cover today, just a very high level, we've done several working group meetings and we've got some terms of reference. We have worked to align our schedule of capital funding with the RHD planning cycle. So hopefully there's been some improvements towards that. And then you'll see some reconciliable projects. I am going to pause for a second though. Heidi, did you want to add anything to this particular section on the slide? I know you've been involved.
Yeah, I think I just wanted to share last time we presented last fall, we had proposed these working groups, the addition of working groups, just to help us, build those relationships together and share. And I think those have been really successful from our standpoint. And I hope the RHD chairs would agree. And we've had 3 to date and look forward to continuing them on after this meeting.
Thanks. And obviously we will be happy to answer any questions, but if we can go to the next slide. I will just touch on the lens that we use when we do our planning. This is also something that Vancouver Coastal Health is very proud of. Whenever we do any planning or any work within our health authority, we have these as sort of pillars that we look to in terms of providing exceptional care, of course, which most people would associate with Vancouver Coastal Health, I hope. Looking at innovation for impact, making sure we are indeed a great place to work. If we have happy staff and well-meaning staff, we have productive staff, we usually have well cared for patients and clients and residents. And that leads to our last pillar, which is having healthy people in the communities we serve. And the next slide talks about some of our planning principles. You can see these. I don't think any of these would surprise you, and you've probably seen these before. You've been around for a while, but certainly looking at the way we look for our planning, our projects and priorities. I think the couple ones at the end there, in terms of Indigenous health, I mentioned we are quite proud of that. Certainly being stewards of our environment with planetary health, and then obviously making sure that we have diverse equity and inclusion in our the way we think through things. We want to make sure our workforce represents the communities we serve, and so that is also something we bring forward in our planning principles with all of these projects. Okay, with that, I know I speak very quickly, but I'm pressed for time because I know we have a lot to squeeze in. I'm going to pass over to, I believe, Heidi, you speak in the next session. Thank you.
Yes, please. Next slide, please. So our capital needs are really focused on several areas. The first is our health vision, so our longer term comprehensive planning, which which is underway. Our Indigenous health initiative, so working with our nations to ensure that the care that we deliver and the capital needs that we focus on, they're also seen in that. Long-term care, so supporting our aging population as they grow here in the Sea to Sky. Emergency department renovations, so we know we're seeing more patients in our emergency department, so what can we do to support those volumes? Supporting our mental health and substance use population. Surgical services, we offer a great service here in Squamish and want to maintain and continue to grow that in the corridor. Looking at diagnostic imaging, any aging imaging that needs to be replaced, like CT or X-ray. Infrastructure deficits, things like parking upgrades, and then lastly, community service. So these are all the areas that we're focusing on when we're investing in capital. Next slide.
Okay, I'll be speaking to the next following slides, and this aligns with our memorandum of understanding to be transparent on the Coastal Community of Care's revenues in terms of expenditure projects as well as priorities. So for this slide in particular, I want to show the forecast of the Coastal Community of Care for the revenue. The orange bar represents the foundations and auxiliaries. And for fiscal 25-26, the orange bar is heavily distributed because it's attribution to the Lionsgate Foundation contributions to the new Paul Myers Tower. And the blue bar represents the Ministry of Health revenue based on the annual routine capital investment allocation. And the green bar represents the regional hospital district's revenue towards the cost share commitments. For fiscal 27-28, we don't have the priorities approved yet, so the bars aren't showing as much for the distribution. Next slide, please. For this slide, it is to show the Coastal Community of Care's expenditure. The one of interest for this group is this Squamish CT scanner. We intend to start construction in January, which is our fiscal 25, and will continue through to fiscal 26. And so we can show where the cash flow is allocated for the CT scanner. Next slide, please. This is the list of fiscal 25 prioritized and approved routine capital investment projects. The ones in the Sea to Sky region are highlighted in yellow for ease for you. And we received over 5.4 million out of the 10.8 million of funding for the Sea to Sky region, which is 50% of Coastal's allocation. So it includes projects such as Squamish generator replacement, boiler replacement, Pemberton X-ray upgrade, and the Pemberton electrical distribution and phase protection. We'll go over the cost share allocation in the next few slides. Next slide, please. In one of our working groups, we wanted to show which projects were closed and completed, and it was requested that we also align our funding to reconcile. So next slide, please. We'll go over this list of projects. In yellow are the projects that have had RHD contributions and have already been complete. Next slide, please. This is the list of projects underway in various stages of projects and life cycle of projects, and outlines the budgeted funding sources for each project. For the ones in Squamish General Hospital, the fluoroscopy project number 2 is already complete, and we'll start reconciling the budget with the RHD. The one that is active in the corridor is the Squamish CT scanner, which I mentioned earlier on line 9, and outlines the various funding partners who support this very important project. The recently approved project is the Pemberton X-ray, and we'll talk more about that in the fiscal 25 cost share request in the next few slides. Next slide, please. This is the list of equipment that has been approved for the Sea to Sky region and outlines the funding sources for each equipment. The two highlighted in blue are the Squamish Portable X-ray and the Pemberton Portable X-ray. And these are part of the fiscal 25 cost share request for the RHD that we'll summarize in the next slides. Next slide, please. Yeah, so Heidi, I'm going to pass it to you to summarize, please.
Great, thanks, Belinda. So this is the summary of our cost share request here today for FY25. We have 3 items. So the Pemberton X-ray upgrade for the Pemberton Healthcare Center. The cost share request to the RHD is $680,000. This replacement will replace our old digital X-ray, our old analog system with a new digital X-ray system. This will obviously improve our image quality, reduce radiation exposure to patients, and just speed up image processing. There is a small renovation included in this cost, and that is with any replacement of imaging equipment generally requires a bit of a renovation to fit that in. The second request is a portable X-ray replacement for Squamish General Hospital. The cost share request to the RHD today is $86,280. So portable X-ray, we use this in Squamish in the emergency rooms, the operating rooms, our inpatient wards, to help support patients that may not be clinically able to go to the standstill X-ray that we have. And then lastly, we have a portable X-ray replacement for Pemberton Healthcare Center with a cost share request of the 40%, $48,255. This is replacing the current portable X-ray that is really obsolete technology, and this will help to increase any downtimes that we face by not having this equipment, and again, reduce radiation doses to patients. You will notice there's a difference in cost between the 2 portable X-rays from Squamish and Pemberton. The reason for this is we are purchasing the Pemberton upgrade and the portable at the same time for Pemberton, and they can actually use the same DR plates. So there was a bit of a cost savings there with purchasing those at the same time. So the total project cost share request today to the RHD is $8,114,535, and that represents 40% of the those 3 projects. Next slide, please. Okay. And lastly, we just wanted to touch on some of the capital priorities that are underway and upcoming priorities. So you're well aware of the ongoing Health Vision, Sea to Sky, and the longer term planning. We're in our draft clinical service plan and infrastructure planning phase, and we look forward to coming back to community and the RHD in the late fall to share and engage and receive feedback from you. Our upcoming priorities, these are not funded priorities, but ones that we're working through feasibility and costing for, are a modular expansion to the footprint of Pemberton Healthcare Center. These are interim measures for longer term planning, but this would support community programs and primary care growth. We're also looking at the feasibility of replacing the CT scanner in Whistler. We are looking at ED department optimization initiatives at both Squamish General Hospital and Pemberton. This is really to support the volumes of patients and to improve the triage areas where patients are sharing their concerns with nursing staff. The upgrades to the medical device reprocessing department. So this is the area that cleans and disinfects and sterilizes our medical equipment for the OR. And so we're looking at improving that area with upgrades to equipment and HVAC and electrical. And then ongoing, there are always various other infrastructure projects that we're looking to replace or upgrade. And that's really to keep the lights on and the buildings moving to support our patients and our staff. So with that, I think we'll close. There is an appendices with lots of information for the RHD if they'd like to look at, but again, you've probably seen a lot of this before. So I'll leave it at that and open it up to any questions. Thank you.
From the board?
Suzanne's also available.
Great. Dr. Bengal.
Yeah, this may be a naive question, not understanding capital in the various categories, but in Squamish, we had a public hearing, and basically what came out of that is there is one doctor who is housing locums and visiting doctors and nurses because there's nowhere else for them to stay while they're providing service. And again, in my naive mind, you might hope that there's some capital investment in housing for medical staff and so on. And so I guess, is this the sort of budget where we might expect to see that sort of thing? Or is there a way to advocate for that? Is it in this sort of context where that would happen, or the master planning process, or housing?
Well, I'm not sure who will take that. I'm happy to jump in, but thank you for the question, and entirely relevant and very timely. We know that housing for our staff and for our residents and locums is a huge concern. It is a concern across Vancouver Coastal Health and indeed the province. We have lots of traveling nurses. We have locums doctors going across. I would say the answer is not strictly capital. It could be operating as well. So in terms of the funding, it's on our radar, and it is part of the master planning process that Belinda is leading with her team. But we have some very pressing needs. So I think between Heidi and myself, we should follow up with the doctor you referenced and actually take a look more specifically rather than wait for a big long plan. If there are housing needs and things that we can address in the short term, that's an operating issue, but we can deal with that. So if you're okay with that, I'd like to take that offline and see where we can sort of maybe come to some solutions there.
Anyone else? I just want to say that for a very long time, this board has been doing our best to communicate to VCH that when you make allocation requests, please bring things to us that are sort of regionally relevant. And I feel like this is well done on this one. This one feels important. This one feels like it's not replacing pipes. That feels like VCH's job and not something that we want to contribute to. And so I think this is a step in the right direction today. So grateful. It feels like you've heard our voice. It's terrific.
I'll second that.
Okay, all in favor?
That's the best request I've seen.
Yeah, there it is. Very good. Okay, I don't see any other questions. Anything final from any of you or, oh, sorry, I do.
No, it's not.
Sean.
It's not a question. I wanted to catch these guys before they go.
Okay, go ahead.
Yeah, okay. I live in Ferry Creek. It's a community that has a lot of senior citizens, should I say, who tend to have a need to go to the emergency room at Squamish quite often. And I just want to pass on to you that I've heard nothing but positive comments about the kind of care they get there, service and everything. So people feel very strongly that it's a good place to go. So I just would like to hear them.
Thank you. Thank you for that. We'll be sure to pass it along to the staff. Yeah, you do excellent work.
And Mr. Chair, if I could, I'd also just like to add, not on the agenda, but certainly we talked internally about Hilltop House and the announcement around a new long-term care facility. You'll note that we have not come to you with a cost-sharing request for that, but certainly want to put that on the table that if there's an opportunity and desire for you to partner with us and collaborate, we are very willing to look at that, but we're not going to come to you and ask for your 40% share of that. That is something that government's put on the table as a priority, so we're very pleased to bring that forward. And yeah, as I said, any collaboration opportunities, more than willing to discuss with you guys.
Quick question.
Sorry, another quick question. Sean, you're never going to get out of here.
No, you're not.
Yeah.
Just following on from the comment you just made, do you have any plans at the moment for how the existing building will be used in the future?
Yeah, very good question. And it's been on the radar. So to be honest, I'm going to sound a little cagey to say it's under discussion. There are conversations underway around how to repurpose that in light of the existing Squamish Hospital. But if you're aware, we have a very large long-term care bed gap across our region in the Sea to Sky corridor. So there are conversations around how we may utilize that in the short term. So I would say stay tuned, and that would be part of the conversations we'd like to have with you, I think, coming up. So lots of conversations to come, but still somewhat TBD.
Great, thank you very much.
Sean, Heidi, Belinda, thank you for your work and for your time today.
Thanks. Have a great
Thank
day.
you for having us.
Thank you.
With that, we'll move on to approval and receipt of the minutes of our June 26th meeting. Receipt. seconded by Director, what's your name, sir? Rainbow. Are there any opposed? Motion carries. Business rise from minutes, anything anyone would like to speak to? None. CO verbal update.
Thanks, nothing to share.
Okay, direction request, the meeting schedule, any thoughts? I have some. Do you have a presentation for us?
17 slides.
Okay, goodness gracious, it's
Good
exciting.
afternoon, Angela Belsham, Director of Legislative and Corporate Services. This report is requesting direction from the board on alternate 2025 meeting schedule at the Sea to Sky Regional Hospital District. The 2024 meeting schedule followed the historical practice with a frequency of 9 meetings. And they were held on the Wednesday of each month after the board meeting. Last year, there was a decision to move the meeting from 3:30 p.m. start to a 3 p.m. start. So there has been some conversation amongst the board with an interest in revisiting when the meetings are. And so this report is just to bring forward an opportunity to discuss that before we bring the calendar to the Hospital District Board in December, which is our.
I don't see the hand, so I'll speak to it. Reading it, the 9 a.m. idea sounded like it made a lot of sense to me, because then the northern directors aren't having to leave all the time and we're not interrupting these meetings, and I'm usually doing work between 9 and 10:30 anyway, so that just seemed like a reasonable suggestion to me. I saw some nodding heads.
So you're saying the 9 a.m. on Wednesday?
Yeah. So we would be 9 to 10:30 and then
9 to 10:15.
10:15, and then the board would follow.
Yeah.
Okay, moved by
Yeah.
Director Mack, seconded by Director Richmond. Any further comments?
And that doesn't impact the area A and B folks.
No.
They just need to get here by 10:30.
Yeah,
Just-
and then we can go, we don't have to.
We can
stop.
finish this,
Yeah.
finish our board
Yeah,
meeting.
yeah,
Yeah, excellent idea.
which is funny that we haven't been doing that before.
It's your new CAO.
It's true, way to go. Are there any opposed? Motion carries. Oh, okay, no, sorry,
Get up
sorry,
there.
forget it, you're out of luck. Chair's verbal report, I'm going to slide something in the chair's verbal report that I didn't expect to before. If we wanted to, we could write a letter to VCH supporting the allocation request that they made today. Is that something that we want to do, or should we wait to a future meeting? Director Richmond.
I mean, I agree with your comments earlier that these were more in line with what we were looking for. We also kind of talk every year about getting a little more input from our local healthcare providers. And we don't usually rush into making this decision right on the meeting. I don't want to drag them on, but I wonder if there are any more considerations before we allocate that kind of money from our budget. Are there any more considerations that we want to throw out there, again, from local providers, from anywhere else? I don't know. I don't have anything on top of mind. We just don't usually roll right into approving or not approving. Well, we rolled right into not approving.
That's different.
But I just wonder if we're comfortable with it. Again, I don't mind these requests. They make a little more sense, but we haven't considered anything else.
Yeah, fair enough. Director.
The request that they've got
Yeah.
from a permanent point of view, our clinic, that stuff that I've heard from Dr. Fuller as a priority, all the stuff. So I think they would be very happy that these guys are actually paying attention to what they're complaining about. Like that X-ray machine, that's a huge thing. Because you couldn't get an X-ray taken here, you had to go to Lionsgate because they wouldn't accept the X-rays these people were sending them.
Yeah.
So, I mean, that's a huge benefit right there, just that.
Yeah.
Now, they did specify that they are looking into the modular expansion of the building in a short term. Is that
I made that ask last week with BCH staff saying that we need to bridge between now and the master plan.
Yeah, I mean, we've been bringing this up for the last 2 years at our hospital board meetings. I mean, they are beyond cramped. I mean,
Yeah. no,
they've got
no.
people working on top of people in there in offices.
Paul.
Hi, thank you through the chair. I just wanted to clarify one thing. Suzanne LaFrance, Director LaFrance is here to answer any questions. What the request would be that the board write a letter to Vancouver Coastal Health, and I'm reading this, to advise the board's willingness to contribute to the cost sharing items as outlined in the presentation, with the allocation of such cost shared funding to be referred to the 2025 budgeting process. And keeping in mind that our next meeting here is not until December, and I'm unclear on Vancouver.
So our willingness to support it, but it'll be referred to the budget process.
Yeah, so it gives them feedback, hey, we liked what you did, we're likely gonna approve it in the budget process.
But do we not have the funding in the budget right at the moment?
Oh, we've got lots
Yeah.
of money and this is.
Don't say that.
No, but what I like about what Director Richmond is pointing to is that they've heard our voice, they've responded
Yeah.
differently than they have. But one of the other things that we said we would do is reach out ourselves and understand if there's other asks that we would want to bring to the table and suggest back to them. And that's where some of that money could go. So I think this letter doesn't stop us through the budget process of suggesting something else that we might want to do. I mean, it's interesting to hear the question about housing. I'm not sure that's something that we want to do as the hospital district, but it was an interesting consideration.
Well, I know that, like, say in Merritt where they're closing every other
Yeah.
weekend. And also in Lillooet too, and talking to Vivian's husband, who was a doctor there. The situation that's happening is a lot of these doctors that are coming into these small towns are coming from Saudi Arabia, Iraq, Iran, you know, and he said a lot of these young people that are coming in are extremely wealthy, well-educated people. But they only work Monday to Friday in their offices. And so then they sign up to have to put time in on the weekends in the emergency room. Well, they put their time in their office, which they get paid for, but they don't want to work in the emergency room, so they book off. And that's why he said, there's people available, but they're just not showing up.
Yeah.
So he said, somehow they have to fix that. I don't know. We are so fortunate in our clinic.
Yeah.
Like so fortunate.
We've been for years complaining to them about asking us to put in a new toilet, pave up in the land and things like that. And when I looked at that today, I thought, wow, they finally listened. And I can't see anything against any of those three things, but I do take the point that there may be something else that isn't considered there. So if I'd like to kind of communicate to them that we're feeling positive about that. That if we go into our budget process,
Moved by Director Rainbow.
I'll move that if that's.
Yeah,
and I would
by
just-
Director Mack.
I would include in that letter that we want to, you know, we are, we've shown some strong support for the asks, and we would like to also have a little time to talk to our local providers to see what other priorities they might have for us.
Yeah. And I would say, we need to talk to Dr. Fuller and whoever else he decides.
So
For Pemberton anyways, and then there's Whistler and Squamish, same thing. To get their take on what else is needed.
So maybe we pass the motion and then have another question.
Okay, are there any opposed? Motion carries. Director Richmond.
So what's our next step to get that information from be it Nick and Pemberton or whoever, Whistler, what's our next step to get, is it a letter from the chair saying, hey, you know, we're considering our budget, are there priorities within our budget?
Oh, I like that, to the head of each emerge, like,
This is public, isn't it? It's information.
oh, yeah.
Yeah. So if we we ask for anything else from doctors, or we can make sure they reference this so they know that this is coming.
So motion to write a letter to our local clinics and hospitals requesting their short and long-term infrastructure priorities.
And maybe to Tony's point, prefacing it with, this is, the board is looking at supporting these VCH requests.
Yeah.
For upcoming services. We're looking to our emergency rooms and our providers to, for any other priorities they might have, but also in the context of, let's remember that this master plan is happening. I don't want to open the door for, we need a new hospital in Pemberton, like, that's not what.
Yeah.
You know what I mean, like, that's not what we're talking.
So like actually put it into the like scale it according to helping them understand what our budget is. Like our budget is not.
Yeah.
Yeah.
And then while we're working towards a master plan with VCH that will hopefully address some of our mid and long-term priorities, with that, preface it with that, are there any short-term priorities that you would like us to consider?
One
So-
thing I would just like to ask, though, when is this work supposed to start? Like, say the new X-ray machine going into Pemberton Clinic here. They've approved the money and they're asking us to put our share in. So is it already approved and they're gonna start replacing this thing like now? Or are they waiting for us to confirm our contribution?
It's a fiscal 25, so they won't start until 25.
Yeah.
Okay.
So I think Director Belsham has recorded this discussion. I was watching you type. I will happily work with you as the acting chair to ensure that the letter that we send off reflects this conversation. Okay,
Perfect.
Very
are
good.
there any opposed? Motion carries. That was I want to just congratulate myself on what a great chair's verbal report that was.
That's my hand up, you didn't recognize me,
I
I was
know.
just going to say that.
Oh, you were? Okay, good. We'd like to make a motion. Recent healthcare announcement.
Director Ford, where's?
Receipt. Okay, let's move receipt. I just wanna,
You got that here?
yes, it's in the,
Receipt.
So it is,
yeah, second by myself. Are there any comments? This is great news, very great news.
Yeah.
Call the question, any opposed, motion carries. There is no late business. Are there any notices of motion? Seeing none.
I had a question that I'd like to raise now for some future consideration.
Okay.
And I wanted to talk to Mike about this before this meeting, but the Sea to Sky Community Services Foundry project.
Yeah.
Here. I was talking to Jay Russell about it, because she approached me about some funding, because we put money into the Squamish one. And so I was talking to her about funding. And the question that I had, and I would like to sort of refer to Suzanne, like to discuss here sometimes, can we, as a hospital district, tax to help fund the Foundry project?
Yeah, absolutely. We did under one roof, like we can.
It can come out of our budget if that's the question. It can come out of our.
Because I did ask that question for somebody and I was told it had to be, it has to be for a health service. Okay, good. So we're on the same page. So that's basically.
I mean, let's, Ms. LaFrance, do you want to correct us?
Yeah, so we can provide tax funds to any health facility that's designated by the minister as a health facility. So it just has to have that designation and we have no problem funding it.
How do we get the designation then, or how do they get it?
It is something I'm not aware of, but it's through the Ministry of Health. So we would have to contact them with the project and ensure that it's approved as a health facility. I think it happens when the facility is built, but I'm not sure of the process.
I think the Foundry
Yeah,
is.
it is,
It qualifies, but we should check that if we're gonna have this, and we should probably maybe work with whoever is gonna chair this board so that we're organized to answer some of those questions at a future meeting.
Yeah.
Cause I think that's an interesting, I mean, we like under one roof, we contributed to, which was exciting to be a part of.
Okay,
Great.
So maybe just, thanks for bringing that up, Tony. You know, Cedar Sky Community Services is partnering with VCH for some space in the building, Foundry, and it's all, you know, mostly health and mental health based. And they're working really hard to raise the funds to be able to provide those services. I'm wondering if we can send the same letter we would send to the doctors to Jay from Cedar Sky Community Services to see what priorities they might want us to consider as well.
Good.
good.
Yeah. Okay, there'll be, is that, you don't need a motion to add Jay to the list of recipients of the letter, do you? No, perfect. Motion please to adjourn this meeting, moved by Director Rainbow, seconded by Director Mack. Is anyone opposed to that motion?